technical difficulties this evening, but we finally got it on. Facebook pushed an update, and of course, I don't know how to work it. So we are back. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going over arch pain with running. Running seems to be the new thing to do. It's resurrecting itself now that gyms are kind of closed, sort of closed, limited capacity, so a lot more running injuries are coming in. So let's talk about arch pain with running. So obviously, as I say every time, it is something that we got to figure out where it's coming from. It's not something that we just want to say, put some ice on it, and it's going to go away. It's coming from somewhere. It's really important that we figure out why we have that arch pain. So first of all, it could be coming from improper shoe wear. So always make sure that you are running with the best shoe for you. If you haven't been fit at a running store, go ahead and get yourself fit properly for a shoe. For someone like myself, I have a very flat foot. I need a very what we call a stability shoe, but just because your foot is flat doesn't mean that you need a stability shoe. You want to have somebody watch you walk, you want to have your foot assessed. So make sure that that is the first thing that you check, and also make sure that you check to see how much mileage is on your shoes. You should have a mileage tracker somewhere where you keep track of when you change your shoes. I know for me it's 300 miles, which is the life of a shoe. Your shoe is not going to look broken down, and if it does, you're way past when you need to replace your shoes. Shoes are going to have more wear on the inside that you're not going to be able to see. The shoe's going to start breaking down and not going to be able to support you as much as it should. So, but this is not visible from the outside. Usually you will see no wear when you go to change your shoes, which can be a little bit frustrating, but the internal components of the shoe are what break down first. You might have a little bit of wear if you land on the outside of your foot, but be aware that it's not going to show any outside visible breakdown. So don't wait for that shoes to become old and ratty before you get rid of them. It's something that you want to keep track of, so you have that every 300 miles, you're putting them away, you're getting a new pair of shoes. They can become your walking shoes. That's generally what I do, is I move my running shoes to my walking shoes, and then I have my running shoes. But my body can definitely tell me when there's a problem, or when we're over 300 miles. So that's first. Always check your shoe wear. Always make sure you're wearing the right shoe for your foot. The second is also you want to check your balance. So a lot of times people, first of all, say, I have bad balance, it's hereditary. No. Nobody has bad balance, that's hereditary. If you have an ear problem or a vision issue, that is hereditary. That may affect your balance, which may be hereditary. But using the excuse that my mom or dad had poor balance does not work. So you want to check your balance. And why do you want to check your balance? Because when you have arch pain in your foot, a lot of times it means your toes are gripping for dear life in your shoes. And again, these are things that you don't realize when you're running. You're just out there running. But when you don't have proper balance, and it may be you don't have proper balance because your leg isn't strong enough, your hips are weak, you don't have proper core stability, whatever the reason is, and again, it's like, this could become an hour-long teaching segment, but whatever that reason is, your foot, your toes are grabbing on for dear life. They're needing that contraction to stabilize your foot. So be aware that that is going on, and if that's happening while you run 3 miles, 4 miles, your foot is going to get exhausted. Therefore, the arch, where those muscles are, is going to be painful. You're going to have a lot of pain in that arch. So if you stand on one foot, close your eyes, and you're like this, that's a balance issue. All right, you should be able to stand here, closed eyes, 30 seconds, no problem. And a lot of times what you're going to notice is the minute you pick up your foot, you start to feel your toes dig into the surface. If you feel that, you need to work on your balance. You should be able to have a nice relaxed foot, and you should be able to balance, close your eyes, 30 seconds, no big deal. Obviously, you're going to move around on your foot a little bit, that's okay, but you shouldn't need to claw your toes into the ground in order to maintain balance. Running is a single leg activity. People don't always realize that. You're never on 2 legs when you're running. You're hopping literally from one leg to the next. So you need that balance. You need that stability. And if you're lacking that, if you can't do this, That translates into running, and people say, no, that doesn't mean anything. I'm only on my foot for a few seconds. Yeah, but your body's got to stabilize that few seconds. And if you're wobbling around, that's an issue. And I say close your eyes because nobody's running with their eyes fixed on a certain point. You know, we're looking around, we're distracted. That closing of the eyes takes our vision out of it because most of us are looking around or moving our head or we're having a conversation. So when we close our eyes, we're able to actually see how our balance is. So when you're hopping from one leg to the next, you're going to have some problems if you don't have good balance. That's going to cause your foot to claw into the surface of the shoe, and then that's going to cause some arch pain, which can lead to plantar fasciitis, which can lead to Achilles tendonitis. So it's not something that you want to ignore because it's always much worse the worse it gets, the worse it snowballs. So be aware of this balance issue. It's a very easy thing to train. You can stand at your kitchen counter. I always tell people when they're brushing their teeth, to start brushing their teeth, close their eyes, and start balancing. Relax your foot. That's part of the issue. So those are a couple of reasons why you're going to have arch pain when you're running. Some of it may be that you already have a plantar fascia irritation. So if that's the case, then you're going to have to get that treated, or we're going to have to go through some exercises. But either way, arch pain is not something to be ignored. It's not something to dismiss, because what's going to happen is it's going to get worse because you're going to then change the way you run. And when you change the way you run, you're going to get ankle pain, knee pain, hip pain, all the way up. So it's something that you really need to pay attention to. And again, when you change your running form, you don't realize you're doing it. It's just a simple unloading of your leg or something along those lines where you don't even realize you're doing it. It's just like, I don't want to put pressure on my arch, so I'm going to roll a little bit more to the outside of my foot. Very important not to do that. That's when we start to do or have a lot of knee pain, hip pain, and things like that. So arch pain is something you really want to pay attention to, and we always have a free consultation that we offer. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. So let's go through what you can do when you have some arch pain. So the first thing is I always recommend getting it assessed. Getting that, why do you have arch pain? Maybe you're walking and your knee is collapsing and then you're collapsing on your arch. There's a lot of reasons why you could be having arch pain. I gave you two very brief reasons, but there's a lot. If your hip is weak, you can be collapsing in on your knee and then collapsing in on your foot. So just to say, oh, I have arch pain because I don't have good balance is not enough. Figure out where it's coming from. It's the most important part of solving anything. If you don't figure out why you have it, and it wasn't a traumatic injury, meaning you didn't fall, you didn't trip, you didn't sprain your ankle, and then you don't know why it's there. Figure it out. Arch pain is not just arch pain. Arch pain is something inherently bigger. So find out what that bigger is. Go the next step. Why is that? Why is that? Why is that? So when we talk about arch pain, I'm going to show you how we would treat just some pain in the arch. But again, it's not how you want to treat this overall, because you've got to find out why you're getting that. This is what I'm going to show you is a couple of Band-Aid things, but it's not the reason why you have arch pain. So the first exercise I'm going to show you is just a simple stretch. You're going to keep your toes flat on the floor, and you're just going to bend your foot up as far as you can. You may not feel a stretch with this. That's totally fine. Do not wrench your body or your foot in order to be able to feel a stretch. If you bring your foot all the way up and you don't feel a stretch, no problem. Still hold it there for 30 seconds, count to 6. You're still going to get some benefit from it, but don't start bending down, twisting. That's when stretches really become a problem. You're not meaning to feel every stretch so intently, all right? But chances are, when you've got a sore arch, especially after running, you keep your toes flat on the floor and you lift your heel up, you're going to feel some stretch in there. Don't stretch to the point of pain. Just stretch to the point of feeling good. You can then take a golf ball. This is a BC ball. Anything with spikes on it, anything with ridges on it. And you can start running that underneath your foot. The more pressure you put on it, the more it's going to break up whatever's in that arch. So some of you may not be able to tolerate something this aggressive. This is pretty aggressive, and it can lead to be very sore. So you're going to break up a lot of that tissue underneath there. Don't try and get it all at once. All right, you're going to find a lot of tender spots in there, especially if you're dealing with arch pain. So don't try and hammer it out in one time. 5 minutes at a time every day. You want to go all the way back to your heel and then all the way up into your toes. Again, just treating your arch is not going to solve anything. It's going to be cleared up for a day or two, and then it's going to come back with a vengeance. So just rubbing the inside of your foot is not okay. You want to make sure you're going into the toes. You want to make sure you're going up into the heel and then actually all the way up into your calf, since all of that is connected. And the final thing you want to do with that arch pain is you want to take a plastic bottle and you want to fill it with water and freeze it. Run it underneath your foot, 15 minutes every day. I know there's always a controversy on ice versus heat. Really, let's not make that big of a deal out of it. It is not a big deal. Just throw some ice on it. All right, it's going to help that inflammation. It's going to help the pain. You're not going to ruin anything. Somewhere along the way, this big controversy, it's ice, people. So put some on there, all right? The best thing to do for a foot injury, especially underneath the foot, is to put that plastic water bottle in the freezer, let it freeze, run it underneath your foot 15 minutes. That's going to help with the arch pain. But again, as I always say, make sure you find out why you have arch pain. Arch pain doesn't exist in a bubble. It exists for a reason. Find out what that reason is. If you or somebody you know is suffering from arch pain or any type of pain and wants a free consultation with a physical therapist, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.